Hi, everyone. I just want to say thank you so much for joining me today, tonight, whenever you're consuming this content. Today, we're going to talk about preparation and patient buy-in for your therapy sessions. So I'm going to share my screen and then we'll get started. So these videos, I want to make them fairly consumable, so not too long, but I just ask that you attend to the task, attend to the video, give it all you got. Remember, where focus goes, energy flows. So if you're having this on in the background while you're doing other things, are you getting it? Maybe, probably not as much as you could. So let's lock in and let's get started. So today we're going to talk about preparation and building buy-in. So, anytime someone comes into the clinic or anytime you walk into their school, you are going to have to you're going to have to introduce yourself and you're going to have to get buy-in from the patient. I think our occupational therapy counterparts do it really well. I think they focus on first building a relationship and then getting to the goals. But most speech therapists I know will pull a child into a therapy room or into the class and just go right away. Hey, what's this? Who's this? What's this? What color is this? Say more. More. Do you want it? Say more. And so I want to take the therapy piece out. And I just want you to imagine that someone brought you into a new building that you never seen before. The people were really nice and they said welcome, but then they took you back into this room with a lot of cool toys. Think of your favorite things, right? Like maybe a VR or your favorite television show. But then they were like, well, you have to do these things before you can get your favorite things. And you weren't sure why you were there or when you were leaving. And so that would make me feel very uncomfortable. And I have words to say, I'm not really comfortable with this. Why am I here? A toddler or a child that's brought into the therapy room doesn't necessarily have those words, but we do that to them all the time. All right, we bring them into a room, we treat them real well, but they have these things that they may want to say, but they don't know why they're there, and they don't know when they're leaving. And then when we get these crazy behaviors, it's like, oh my gosh, this kid tried to bite me or swipe me, and there's no way, we have a very low tolerance for that. But on the flip side, before you just start pulling kids in a room and doing it, consider getting buy-in. Okay. So first you have to get the connection. You have to form a genuine bond with them through play. That's how we do most of our therapy, right? And your trust emerges when the child feels understood and heard, right? You also have to be flexible. So a lot of times we prep all these materials and we have all these things on the table and or in our head, and we want this therapy activity to go just exactly as we've planned it and we want to. And some of us dig our heels in, man. It's like, man, this ship is going down, but we keep on fighting for that therapy activity. And then another thing is preparation. So it's kind of the opposite, and you have to kind of go in a slippery, it's like you have to find the balance, right? You want to have enough materials and strategies ready. I'm a person who prefers to be over prepared for something, whether it's a session, whether it's a meeting, whether it's a speech I have to give, because I never want to run out of material. But more times than not, you run out of time before you run out of material. Now, I have seen therapists that aren't quite prepared. They'll come into meetings, they don't have their word list ready. Like if you're working on Artic, you know you need the words you're going to use, right? If you don't know them when you walk out the door to get the kid, it's probably not going to come to you when they're in, right? So it's always great to be prepared, but be flexible at the same time. So here's some pointers when working with toddlers. If you don't get anything from any of this, listen to this. I always want you to repeat what the kid says and add, okay? So even if it's an approximation, even if it's a half a word or if it's one word, repeat and add to it. If the child says car, car, sometimes they don't have that R yet, you're gonna say it and then say something else. Car? Did you want this car? Or car? Yeah, it's a red car. I like the car. Let's play with the cars. So the repeating and adding, if you're kind of still trying to find your footing, as in like, I don't know where to start with this kid, that's a great place to start. Another thing is instead of asking them questions, turn those into statements. A lot of times, and I used to do it and still do it, I have to catch myself. It's a lot of, you know, what's this? What's this? How about this? What color is this? And those are fine, but it's better when you flip it and say, this is a grasshopper. Paper. Look, here's a cord. Look, here's a paper clip. Okay? Um, because we're teaching kids when we only ask them what is this, or if especially what is this, that it's only okay to talk if we're asked questions. But if you are yourself modeling spontaneous communication, they will pick that up too. All right. Um, and then use your own words to describe what they're doing. So in the beginning, but all through your therapy session, it's really important that you're just very descriptive with your own actions, okay? And there's a million things going through your head when you're a therapist, right? I got to get the goals, I got to get data, I have to keep them safe, I want to keep them entertained, I want to at least tackle one of my goals. So it's a lot of things. Is he gonna melt down? Is he gonna transition out? But if you are telling them what you're doing, like with using your language to talk about what you're doing, it is always best. So I have a grasshopper here. I'm going to put it down on the table because I don't need it right now, but I'm going to get the Candyland game because I really want to play Candyland. Don't you want to play Candyland? And then wait. I think sometimes when parents come into the room, guys, it's like or you're trying to prove it to either yourself or the parent or the kid that you're a good therapist. You have the training. You don't have to do magic tricks to show somebody you're a good therapist, right? But you do need to know why you're doing what you're doing. So if you don't get anything in like if from all of this at your time at Speech Builders, get that, right? Like as long as I can explain to a parent why I'm doing something, how it looks is secondary. But sometimes we're just so busy, like, say more, let me show you giraffe, monkey, lion, like all these things. And those things are great. But first, start saturating the child's environment with language or providing opportunities for them to use that language. Okay. The next thing is don't be afraid of parents. And don't be afraid. They're just as nervous as you are. And sometimes I feel their energy. It's like nervous energy. Like they want the kid to perform and they're hopping in and like, what's this? You know what this is? And like you have to take control of that session and like, hey, let's just give them a minute to think about it. Or like head them off at the past. Like, okay, mom, mom, we're going to be working on some things. It's going to look like play, but I'm just creating some opportunities for communication with him. I want us, if you could just hold on to your cues so I can kind of see what's going on. That's always, and then that's helpful. Another thing is at the very beginning, don't be afraid to pull out your laptop or print out the goals or pull out your plan of care and talk about these are the goals we're going to be working on in his sessions. Hey, let's just talk about this real quick and get a plan. Uh, and have the child either watch a video or play with a puzzle or something so you can kind of get a relationship with the parent and just expect, like, I expect them to maybe be a little slow to warm up to me, or I expect them to take their time responding in the beginning, and that's okay. And so if you tell them that, then it's not like, I don't know if therapy is working. But sometimes, and this is not gonna, I'm a straight shooter. You're not sure your therapy's working. And so you're kind of like, well, so and in the beginning, I was just the same way, right? Like, is this working? But if you got the tools, it will work, right? And if it's not working in 6 months or so, then talk with your supervisor and say, hey, we've tried these things. I think we might need additional testing or but we tell ourselves a story that if we can't cure a kid, then we're not a good therapist, okay? So remember the parent is looking to you for guidance because in this scenario, you're the expert. We never say, "Hey, this is an SLPA. They have a bachelor's degree." Like we don't say any of that. And I just want to say most teachers that teach kids everything they know have bachelor's degrees, okay? And so you come in there, if even if you're faking it until you make it, you know, come in there with that confidence and say, "This is what we're working on for this time." But kids are, and always say, like, this is my plan, but mom, you know how kids are. Sometimes they take it and sometimes they don't. Okay. The next thing is keep areas and the table free from clutter. So in our clinic, sometimes storage space can be a little bit tricky. So I see therapists that have a lot of things on their table. And so a child sees all these things and like, oh, I want to play with this one, this one, this one. So even if you put things away or you put them in a shelf that they can't reach, and like this is what we're doing first, or give them a choice of two things, that is so helpful. The next thing is use timers for transition. So I like having the child play with like free play, doing some kind of free play during my session. You can play a game, you can do puzzles, you can watch a super simple song, but using a timer to say, okay, it's time to transition to the next thing, that's a good way to use a timer. Of course, we use a timer to keep ourselves on track in therapy sessions. And also, when I set a timer, I let the child know when we hear these bells, that means whatever it means. That means it's time for us to get back to work, or it's time for us to transition to something else, or it's time to go. But let them know what the timer means, and you can use it for many things, okay? Whatever works for you. If I have a child that's really off task and they just need a minute, I'll set a timer and say, "Hey, why don't you take a minute or if they're like, I want to play with this toy." Okay, you can either say, first, we're going to do this work and then play, or you can reverse it. I'm giving you 2 minutes to play with this grasshopper. And then when the timer goes off, we're going to work on sight words, for example. Okay. Next thing is, I want you to tell them what they're doing. Don't ask. In this day and age, I know we want kids to feel empowered, and we want them to know that they have a choice and that we honor their voice, and we do. But asking questions like, is it okay if we do this? I'm not the biggest fan of. Now, there are times it's like, hey, do you mind? Can you help me carry this into the therapy room? That's fine. But do you want to put the toys away? Well, the answer is no. Who wants to put toys away? It's like asking me, do you want to turn the TV off? No, I don't. I want to watch my show. So instead, it's time to turn the TV off, or it's time to clean up, clean up, clean up. All right. And so telling them puts you in control because whose therapy session is it? It's yours, and you're letting them use your toys, and so a lot of times I won't even let outside toys into the room because if I take something away that belongs to them, I sort of have a problem with that anyway. You know what I'm saying? So even with things like that, hey mom, we're gonna leave this out today. Hey, why don't we let mom hold this Spider-Man, but you can get it when you get back. If it causes a meltdown, consider doing it different another time, okay? And then I'm gonna always recommend a visual schedule. I'm gonna actually, I was gonna pause it. I'm gonna pause and bring my visual schedule. All right, so I have a visual schedule here. It's to do and all done. And I have like what, 6 things here. I have saying hello, I have story time, I have music, I have toys, cleanup, and goodbye. And as we go, I either say, okay, we're all done with this. We'll put it in the all done category. And then we're all done, it's time to go. That usually fills about a 30-minute session. So sometimes if you're like, oh, how's it gonna work? What if we run out of time? Well, we've got a few minutes. Looks like we got a few extra minutes. What do you want to do next? If you don't have a visual schedule, you can use stickies, draw little pictures, and just take one off and have them throw it into the trash. And the last one means when we throw the last sticky in, that means we're all done. But visual schedules are very helpful for you. It keeps you on task. So, and then also it keeps the child on task. It lets them know what's going on. It doesn't say that I stopped sharing, so I hope you could see that visual schedule. Um, if you couldn't, I'm sorry. We're going to talk about that in a moment next week, next time anyway. Okay? All right, working with toddlers. All right, so prepare lightly, observe deeply, select 2 or 3 engaging toys, simple visuals, keep your goal list short and focused. Start with play. You can follow their lead rather than directing and narrate their actions with enthusiasm and build engagement first. You want to be the source of fun and prioritize joint attention over verbal responses. If you're not sure what joint attention is, basically all that is, it's where you're looking, the kid is also looking. So if you have a child that's often like you're talking to them here but they're looking off, it's almost like they're in their own little world. That's a sign that we need to work on joint attention. Okay, so remember to be the toy and not the teacher. All right, let's talk about older kids because as many toddlers as we see, we do have a good amount of older kids. So come in with a plan. Again, preparing those structured activities with alternatives and be sure to review your goals before the session. I know, I know this job is work intensive at times. It's fun sometimes, it's great, it's rewarding when we see progress, but it can also be very like on the back end, you have to do work. You have to plan your sessions, you have to review goals. But I always recommend that you have your plan of care or goals somewhere where you just look at them so you remember because no one's expecting you to remember 15 to 20 kids' goals, okay? Again, start with a connection, casual conversation about their interests, offer meaningful choices, um, create success. Let them win sometimes. Small victories build confidence and engagement. And then use motivation. Incorporate their interests into therapy activities. Make practice feel like play. And so, even with toddlers, ask parents, hey, what are some of their preferred activities? What toys do they like? Not to say that you need to go out and buy what they like, but like if you know they like puzzles, don't bring in, a ball and a bat. Well, please don't bring that in anyway. So remember connection before correction, but just knowing what they like is always helpful. Pointers when working with older kids, review goals with them. Once there was in another life, I had a podcast and I interviewed my niece who was maybe 12 at the time, and she had gone through the therapy process because she had a lisp. And you know what she said? She said that she wished that um, someone would have told her why she was going to speech. Auntie is a speech therapist. And so sometimes we're doing all these things, but we haven't really told the child why they're there. And I've noticed that even in schools, like when we pull kids out, I'm like, who am I? Why are you going with this strange lady? Same thing in the outpatient setting. So review the goals with them. Hey, you're here because we're going to work on you knowing spatial concepts. That means above, it's like prepositions, above, underneath, around, things like that. Or maybe sometimes your speech is not too clear. I'd like to work on that. Would you like to work on that? And so if you tell them why, it's always helpful. And then see what their preferred activities are. Again, a visual schedule works wonders, and use classwork or assignments for therapy activities. If this is a language impaired kid and they have vocabulary words, wouldn't it be awesome if they brought their vocabulary list and you played a game with their vocabulary words instead of some random goals or random words? That would be super functional. All right. And then have the child make their own therapy materials. Hey, can you think of a word that starts with the letter L? You write out the word and have them make their own picture and then hold on to it. Like either send that home with them to practice or and use that for all your therapy activities, but it's something that they've created and it's also something that's not so, let's just get started. All right, so just a little visual here. These are some things you could do. This is not the holy grail of therapy. These are uh, recommendations. So for toddlers, you might want to start with free play. But if you start with free play, just go ahead and put a timer on. In my sessions with toddlers, I either like to do my letter chart to work on oral motor, like my letter sound chart, or I like to read a book. So every time we're gonna read a book at the beginning. I love that, okay? Your role is a play partner. And the primary tools you're going to be using are toys and visuals. And success looks like eye contact, imitation, but success also looks like cooperation, right? Some kids play with toys inappropriately. We have to show them how. Some kids don't know how to sit for longer than literally 30 seconds. You have to show them how. All right. So for older kids, you're going to start with casual conversation. I was watching one of our therapists, she's a CF. I was watching her virtual session and she was just like, "Hey, how's it going? Did you have a good day today?" I just thought that was so endearing because what happened to them is important too, right? And then your role for them is a coach and a guide. And the primary tools you're going to use, I'm going to say games and worksheets, but don't be afraid to think outside the box on that one. Success looks like effort and participation. So adjust your expectations based on their developmental level. Both approaches center on engagement. So, your weekly challenge is try something new. Implement one connection strategy with a child this week. Step outside of your comfort zone and observe how the child responds. Look for subtle shifts in engagement and participation. Sometimes wins are like, they transitioned out of the room or they transitioned to another activity. It's not, they said their name for the first time. That's a win, but sometimes we need those little wins as well. And then reflect, consider what worked and why. Small adjustments often lead to breakthrough moments. So trust your instincts. You have a lot of great skills. Learning how to package them into therapy is where that happens. And that happens in the therapy room. So don't forget the keys to success are engagement, flexibility, connection, and preparation. 85% of 85% of sessions are better when connection is established. You can get up to 3 times as much engagement. So your first priority should always come before technical skills, right? Building the trust should come before the technical. Now, don't forget, guys, you got it. You've got this. Trust the process. Rome was not built in a day. A lot of times our therapist's like, "Well, I've been working with him for 6 whole weeks and nothing's happened." We've seen kids for 6 months crying every session, and then all of a sudden something clicks. So just or the parent will say, "Hey, he's talking at home more." So just because you don't see it doesn't mean it's not working. All right? That's all for this time. Until next time. Goodbye.